mast cells also accumulate and stay there for about 3 days. And why is it interesting about mast cells? Well, it turns out that the response to PDT locally is primarily erythema and edema. And it turns out that the edema can be blocked by antihistamines because it is generated by the degranulation of those mast cells that have been brought in because of the PDT. So you can get rid of the edema relatively easily with these antihistamines. Unfortunately, the erythema is not due to the mast cell or the histamine, and therefore the erythema will persist. Now, there are other things you can do. Maybe we can consider using something like Mirvaso if you really want to block the erythema, but now we're going way off FDA later. Okay. So how do we prepare the ALA to put on the skin? The ALA comes in a applicator. Within this cardboard applicator, there are 2 thin glass vials that the contents have to mix. So there are 2 red dots, one over there, another there, and you press on those dots and you break the vial inside, and then you go down the length of the tube to make sure it's really crushed up well, and then you shake it up. And now you've mixed the ALA and it's ready to apply. Keep it facing upwards because you don't want it to get occluded by all those broken shards of glass. So keep the applicator point up until you need to use it on the patient. There's also a plastic crusher that will crush it for you. Now, this is the way the FDA approved it. We'll start off with that, and then we'll move on to how everyone really uses PDT. You take the applicator, you apply it to individual targeted actinic keratoses. Supposedly you let it dry, but it'll never dry because it has polyethylene glycol, which always will have a glistening component to it. So don't wait forever. Wait 2 minutes. And then you apply it a second time. Then you protect the patient from light for at least 18 hours, usually it's overnight, and then you bring the patient back to your office according to the FDA, and then that's when you expose them to the light in order to activate the protoporphyrin that's been developing over those 18 hours in the dark. So then you get the treatment with this blue light machine, 2 to 4 inches away from the skin. It's 16 minutes and 40 seconds. Why did they get 16 minutes and 40 seconds? It's 1,000 seconds. So that's the reason why. Protect yourself, protect the patient from the light. It's not ultraviolet light, it's visible light, but it's quite intense. So how good is it? If you look at the percent of patients that are clear at least 75% of their actinic keratoses, that's an FDA endpoint. 75% or greater reduction in the number of AKs, 1% of patients have that. The number's a little smaller. Can you see the number up there? Can you read the number? It's 77% of the patients will have that endpoint of at least a 75% reduction. And that's just after 1 treatment. Now, how about 100%? That's a really nice endpoint, right? The FDA loves drugs that treat a disease, and then you don't have the disease anymore. So that would be 100%. And then that is about 66%. All right? If you give them a second course, these numbers bump up by about another 5%. If you give them another second course of the PDT. Okay? Now, the FDA studies allowed for grade 1 and grade 2. These are not Clay's type of histologic grades. These are clinical grades. Grade 1 is, you know there's an AK there, but you just barely feel it. And grade 2 is nominally hyperkeratotic. You just feel it. And the question was, does PDT treat both of these types? Or are you just taking the low-hanging fruit and treating the really easy ones? And the answer is, No, you're treating both grade 1 and grade 2 about equally, and the numbers are up there about 90%, but both of them get destroyed by the PDT. Okay. Now, what happens a year later? You've given the patient the PDT. 83% of the lesions are gone at 3 months. What happens over the succeeding 9 months? Well, it drops down to about 64%. So, yes, there is a recurrence of those lesions, but it's relatively small over a whole year. And again, you may want to give PDT more than once. The good news is safety. There was no scarring in any of the clinical studies. The most common side effect was local skin reaction, specifically that erythema and edema, which we talked about, and stinging and burning, and we'll talk about that. When does that occur? It occurs primarily when you're giving the light treatment. The good news is that it peaks at about 6 minutes. So if you can talk the patients into sticking out and staying in the light exposure, then after 6 minutes the pain starts decreasing. Also, you can use a little fan, and that helps cool the patient down. As you'll see in a few moments, you don't want to cool the skin too much, and I'll show you that in a moment. It's relatively limited downtime. They're usually within 4 weeks, whatever erythema and edema develop, definitely in 4 weeks it's gone. Do the patients like it? Yeah, 94% of the patients like the Cosmetic Results. And the physicians said that 92% of the lesions were cosmetically good or excellent. So on a cosmetic level, PDT is helpful as well. So how can we make PDT better? That was all the FDA way to do it. The one may be shorter than 18 hours, and also it would be nice to use it as a field therapy, broad area, rather than for targeted lesions. Are there any data that you can do that? Well, here's a study that treated patients either for 1 hour, 2 hours, or 3 hours with the ALA, and then gave them the light. And they also treated the whole face, rather than just targeted lesions. 1% of the AKs on the face decreased and went away. Over 90% of them, and it didn't matter if it was only 1 hour treatment, 2 hour treatment, 3 hour treatment. So you just knocked down the treatment time by 17 hours and overnight. You can do it in 1 hour. Again, off FDA labeling. Here's even a more complex study. There were 5 groups. One group got broad application on the face, and then only 1 hour of incubation. Another one, broad application, 2 hours. Another one, broad application in 3 hours. And then spot therapy, targeted therapy for 2 hours. And the 5th group actually had a vehicle. As you can see, compared to vehicle, all the treatments with ALA had a percent reduction in the number of AKs, way above the vehicle. But even with 1 hour, it worked. Maybe slightly less than if you do 2 hours or 3 hours. But if you give a second dose, then they're all up at 70, and over 70% of the lesions are gone, even with 1 hour. And then if you look at week 24, the final result, about 70% of the lesions are gone